For the roundtable discussion, I would like to start with Dr. Satadal Saha, who is really working wonders through digital health interventions, making healthcare accessible to the rural and tribal population in remote areas. Sir, in your technology brief, you told about the digital health. And you made a presentation also, sir. We would like to ask, is digital health a viable substitute that is as effective and accurate as physical examination?
Very good question. I would put it that way, that there are, when a doctor examines a patient, there are certain patient examinations which are purely skill-based and certain examinations which are both knowledge and skill-based. Now, the health workers that we train in an NSQF aligned model and with affiliation from NSDC, but we obviously improve the curriculum and we insist on a 2 months hospital-based internship, which is a mentored internship. So they are trained in certain things like checking for pallor, checking for clubbing, checking for cyanosis, then examining a skin rash. See, when a doctor examines a skin rash, he is evaluating where is the rash, how many rashes, what is the color of the surface, is the margin raised or not, and what is the distribution. So when a doctor examines an ulcer, the doctor examines what is the size, what is the location, what is the color of the floor, what is the margin like, these things. Now, we train our health workers in those parts of the physical examination which are purely observation-based and skill-based. Like there are certain complex examinations like eliciting a plantar reflex or evaluating a knee jerk. We don't train our health assistants in that way. So we are clear in our mind that there are certain limitations to a health worker being able to examine a patient, and we operate within those limitations, and we say that of the primary care problems that a patient will be attending our clinics with, probably we will be able to address 70% of it. For the remaining 30%, it may not be possible to address them through a digital system. They have to go to a physical health system where they can see a doctor in person. But within those limitations, provided the health workers are adequately trained and they are appropriately guided by the decision support system, it leads to fairly accurate and fairly reproducible clinical information.
Thank you, sir. Sir, as we know, even in the most digitally advanced nation, the digital health has not replaced the need for the physical examination. In our country, in our backyards, lack of basic infrastructure, lack of healthcare facilities, the gaps that exist, there are attempts to fill it with digital health. How about combating this gap by building up or amping up the infrastructure rather than going for the digital health thing?
Can you please repeat the question? I just need to understand the question a bit better.
How about the gap that exists in our country in the digital health, in the basic health infrastructure? How about filling this gap with amping up the infrastructure, opening up new medical colleges, providing more training to more and more paramedics, rather than taking the route of digital health infrastructure?
Perfect. Very extremely important and relevant question. Let me address it in this way. First, it's good that the country is having new medical college. It is very welcome. But you see, for a new medical college to produce doctors after their period of education and training will take a minimum of 5 to 7 years, not less than that. What happens in the next 7 years? This is question number 1. 2 is our experience, and this is the national data. The national statistics show that there are 5 states in India where the doctor population ratio is as per the WHO recommended ratio. Even in those states, the rural-urban gap remains the same because a large number of doctors after graduation do not want to go back to the rural areas, do not want to live there. So they work in the health center for 1 day or 2 days of the week, and then they come back to the city. Disease doesn't wait for certain day of the week. Therefore, whereas it is a welcome move that we are producing many more doctors in the country, and I am sure this will go to some extent in addressing the imbalance, unless we are able to improve the infrastructure significantly for the doctors, and that does not include only the health infrastructure, it also includes other infrastructure like roads, housing, water, alternate employment opportunities for the spouses of the doctors. All of those things are very intricately related. Third is the diagnostic technologies. See, today's modern medicine, or whatever you call it, whatever name you give it, practice of medicine is critically dependent on use of technologies, both diagnostic and therapeutic. Now, 80% of Indian healthcare technologies that we use in India are imported. And those technologies do not work in the rural environment, given the power constraints, the heat and dust, then the complexity of usage, the supply chain requirement of various consumables, the maintenance requirement. We have seen so many examples of expensive equipment which have been donated to a village by some good-hearted individuals, which are lying in a state of disuse after 1 year or 2 years, because the manufacturing company cannot send an engineer to maintain those equipment. Therefore, the frugal innovations of translational technologies is crucial if we are to provide access to health for the rural population.
Sir, I would also like to ask you: are people really open towards seeking advice from doctors through a digital medium? Because as we see in cities, the net connectivity is also there, and all things are there, and it can easily be managed if digital health is provided here only. Many people will seek doctor's advice on digitally only. But as we experience, there are very few persons who must be taking advice digitally through doctors in cities and metropolitans. How about in villages? Are people open to it, or they have some hesitations regarding it? So please tell us something about that.
Last month only, in March, I had visited 3 of our clinics, and I spoke to 25 to 30 patients who have availed of our services, and we asked each patient to bring his or her next door neighbor who has not availed of our services. And I spoke to, so altogether I spoke to about 150 patients. Now, I'll tell you the summary of what I hear from them. First is, they acknowledge that the whole country is going digital. Earlier, they had to go to the bank. Now they don't have to go to the bank. And therefore, they are aware that digital health is an upcoming subject. It is here to stay. So in that sense, the fact that many other services have been digitized, issuing of ration card, birth certificate, death certificate, banking, they are well aware of the fact that health services will also be digitized. This is number one. Second,
yes, sir. Yes.
Urban population, for an urban population to access a doctor is much easier than a rural person. There is travel, there is wage loss, and there is expense. So if they can get consultation of an MBBS doctor or a specialist doctor sitting close to home, they are absolutely comfortable with it. And I really did not see any significant resistance in the patient's mind in terms of availing of digital healthcare. What they say, though, is they want to improve the basket of diagnostic services, because we are providing a few now, and they want to see the doctor instead of current once a month, 2 to 3 times a month. So earlier, my fear was exactly what you mentioned, that maybe we have to drive a very strong behavior change communication among the patients in terms of acceptance of digital health service. But that is not really a major challenge. The major challenge is to ensure that the services are being provided regularly, on time, your health workers are competent, your doctors are available, they are behaving properly with the patient, and the system also delivers medicines and a larger array of diagnostic tests. So considering the difficulties of rural area, I would exactly say the opposite. It is much easier to promote digital health in the rural areas than in the urban areas, because the patient living in an urban area can easily access a doctor, 15 minutes walk, and then he is at the doctor's place.
Okay, sir. And how about doctors, sir? The young doctors who are they comfortable with it? Practicing in such a manner, or they want to see the patients and examine their patients physically?
Okay. When we first started in 2017-18, we had one doctor on our payroll. Now we have 13 doctors, 6 of them being specialists. Our cardiologist is from PG Hospital, the Apex Super Specialty Teaching Hospital in West Bengal. Our orthopedic surgeon joins us from Manipal Hospital at Manipal. Our dermatologist is from B.R. Singh Railway Hospital, which is one of the largest railway hospitals. So similarly, all the specialist doctors that we have are from fairly well-recognized medical colleges and hospitals. And the doctors, our mandate to the doctors is very simple. Do what you think you can safely do. Safety cannot be compromised. What you think cannot be done, don't do it. So in terms of doctors also, at a general level, I see an increasing acceptance, particularly among doctors who are fairly senior, who can't travel from this place to that place, but they still have 5, 7, 8 years of working life in them and the necessary wisdom. Among lady doctors who have small children who need to stay at home, who are unable to participate in regular clinical activities. So, in fact, right now I have 2, 3 doctors who are in the queue who want to join, but I don't have space to accommodate them. So I think, although I will not say that all the doctors are really very keen on doing it, I think there is a critical number of doctors who understand the value of it, who are comfortable with the doctor will be comfortable. The doctor's comfort comes from the health worker's training and the quality of information the doctor gets. If the quality of the information, clinical information that the doctor is getting is as per a well-defined EHR, and the health worker at the front end is competent to do certain things, then I think it significantly improves the doctor's comfort level in taking responsibility of treating those patients.
Sir, do you see a need to replicate this model of digital health pan India to the areas, to all the remote areas where the doctors are not accessible? Do you see there is a need to replicate it pan India? That is the question. And if so is the case, then it would not be it would not discourage the infrastructure build-up that should be there.
Okay, just give me 1 second. Yes, see, when we first started in 2017-18, it was funded by DST, and we set up 2 clinics in West Bengal. Today, we have presence in West Bengal, Assam, and Bihar. In Assam, the West Bengal project, the larger project, is funded by the government. The Assam project is also funded by the government, where government of Assam told us to convert one of the existing subsidiary health centers to a digital health and wellness clinic. Now they are giving us 15 more situated in hilltops near the Meghalaya border and all that, where no doctor and no health worker wants to go. So, and Bihar also we have started in Chhapra. So I think there is a strong, I'll respond in 2 lines. One is, I think there is a strong case of expanding access to healthcare using digital means, because almost 30% of the people of India do not have adequate access to primary healthcare. And this is a global problem. 50% of the world's population do not have adequate access to primary care. If I include Africa, if I include sub-Saharan, parts of South Asia, parts of Latin America. Second is that our Honorable Prime Minister Sri Modi announced in 2018 that he will set up 150,000 health and wellness clinics by converting the subsidiary health centers. So the question is, who will run them? How will you provide services in them? Because you have significant shortage of human resources, significant shortage of doctors, non-availability of technology for the rural area. Therefore, to make that dream successful of 150,000 subsidiary health centers to be converted into health and wellness clinics, adoption of digital technologies for patient-doctor communication and frugal technologies for diagnostic, in our view, seems to be one of the most appropriate options available to us now. So I believe there is a case for, first, the states which are high in poverty index, expansion into those states, expansion into remote geographies like the northeast of India, and then pan-India expansion in the digital health and wellness clinics. And just imagine how much of patient data and health data you will be generating every day, which can become an extremely good research subject for public health policies, disease biology, science and technology institutions, etc. Today, we are losing this entire health data. All we are doing is just epidemiological data. We are counting numbers, we are counting age, we are counting gender, and we are just recording how many diabetics are there. But if we can, through this digital model, the data that we collect, it will help you to answer these questions: why patients in certain geographical areas are more prone to diabetic, why certain types of diabetics in certain age groups and certain gender groups are more prone to develop complications, and that will enrich the entire Indian health knowledge ecosystem.
Thank you, sir. I am sure you will set new milestones in the healthcare, providing healthcare to the people.